Glycobiology, Influenza, and Drug Development. In this module, we're going to be looking at the production of second-generation influenza A drugs. The influenza virus has two major proteins on its surface, which are responsible both for the binding to the virus and for subsequent release of the virus after the infectious process. These are known as the hemagglutinin, which is shown in blue on the surface of this cartoon, and the neuraminidase, which is shown in red. These two proteins give rise to the designation that you've all seen for influenza viruses, something like H5N1, where 5 refers to this being the fifth type of hemagglutinin and the N1 being the first type of neuraminidase. There are currently 18 known H types and 9 known N types, and this gives rise to multiple combinations of these particular proteins on the viral surface. Both of these proteins interact with the 9-carbon sugar shown down here, sialic acid, which is also known as N-acetyl-neuramidic acid. In the beginning of the infectious cycle, the hemagglutinin recognizes glycoconjugates that are terminated with sialic acid, and during viral release, the neuraminidase cleaves glycoconjugates at the bond between the sialic acid and the underlying residues. And we're going to talk more about the mechanism of that release later. The linkage of the sialic acid to the underlying sugar, which is typically a galactose on cell surface glycoconjugates, determines the specificity of the hemagglutinin. And what's shown here is two linkages that we can have. We can have the alpha-2,3 linkage to the galactose, or we can have an alpha-2,6 linkage to the galactose. The avian strains of influenza A prefer this alpha-2,3 linkage, whereas the human strains prefer this alpha-2,6 linkage. In terms of the hemagglutinin specificity, it's relatively easy to convert the HA specificity from alpha-2,3 to alpha-2,6 by only mutating 2 or 3 residues in the pocket which recognizes the sialic acid. It's for this reason that we worry about the highly virulent avian strains making the jump into humans. The quest for these flu drugs has been driven by the fact that anytime we use antivirals, we run the risk of ending up with resistant strains. The other reason that's driving the development of second-generation drugs is that while we have drugs which are effective, and we'll talk about them in a minute, it is possible to have off-topic effects, these side effects. And for example, the current flu drug oseltamivir, also known as Tamiflu, has been linked to a number of cases of psychological disorders, including a few suicides among teenagers in Japan. Clearly, these are side effects that you would want to avoid. Thus, development of new antivirals, in particular novel ones, which have a different mechanism of inhibition and prevent the spread of the virus, must be accelerated. The neuraminidase provides a very nice step for intervention in the influenza infectious process. So we already talked about the fact that we have the hemagglutinin, which is responsible for the initial binding to the sialic acid terminated conjugates on the cell surface. After the virus has been taken into the cell and the nucleic acid has been replicated and the proteins have been put into the cell surface, this is where the neuraminidase comes into play. The hemagglutinin, which is on the virion membrane when it gets packaged for release, is still able to bind to these sialic acid terminated glycoconjugates, and so the role of the neuraminidase then is to hydrolyze that linkage to release the virus. So it makes sense then that if you simply add an inhibitor of the neuraminidase, you would no longer be able to have viral release, which will slow the spread of the virus from cell to cell. Let's take a look at the mechanism of the neuraminidase enzyme. In this particular case, we're talking about a glycoside hydrolase from family 34, and this particular enzyme operates with retention of stereochemistry. The way that this mechanism works is that it is initiated by this base, which is a carboxylate, abstracting a proton from a tyrosine nucleophile, which can then attack the anomeric carbon of the sialic acid glycoconjugate. And in this particular case, the leaving group is assisted by an acid donor, another carboxylate. And this is typical for retaining glycosidases, to have the base, which activates the nucleophile, and to have the acid catalyst, which helps with release of that leaving group. This leads then to a covalent intermediate formed between the nucleophile and the sialic acid. And so this mechanism has two steps: the formation of the intermediate, and then the second step is hydrolysis. And in the second step, the hydrolysis again is initiated by a base activating water to give us a hydroxide, which can then help hydrolyze this bond. And again, with reprotonation, in this case of the tyrosine OH, to regenerate the tyrosine, the base, and the acid. The intermediate for this reaction is shown down here, and this is an oxocarbenium ion-like intermediate, so it has a partial positive charge here, and this intermediate then is the same for both steps of this reaction. Neuraminidase inhibitors have been developed based on this mechanism, and the early development showed that if you could have this more planar ring structures, or the half chair, where we've got unsaturation between carbon 2 and 3, simple deoxy neuraminic acid, we end up with an inhibition constant that is about 4 micromolar. This particular inhibitor, though, is not specific for fluid neuraminidase, and it's active against pretty much all neuraminidases. In the early 90s, the structure of the fluid neuraminidase allowed researchers to come up with a couple of different options for developing inhibitors, and they ended up with some sub-nanomolar inhibitors. In one particular case, just making derivatives of the sialic acid, where the 4-hydroxyl group is replaced by a 4-guanidinol group. And in another case where a totally synthetic molecule based on a cyclohexene ring instead of the sugar ring here, giving rise to Tamiflu. And both of these compounds have KIs in the range of 0.2 nanomolar. If we take a look at the binding of the relenza, which is the 4-guanidine substituted version of sialic acid, we can see that this guanidinol group engages a couple of residues which are not involved in the normal sialic acid interactions, which serves to strengthen this interaction. So we have Glu-227, Asp-151, and Glu-119, which are major contributors to this binding interaction. It's also known that the pocket for this 4-guanidinol substituent, there is a water which is displaced there. So there's an entropy effect here when this substrate is binding, which also helps to give that sub-nanomolar Km. So what I'd like to do now is to talk about some second-generation neuraminidase inhibitors. These ones are covalent inactivators. And this is work that came out of the Withers lab at UBC, and there was a science paper that came out in 2013 that documented some of this work. So let's revisit the enzyme mechanism then. And what was done to start down the path of making these second generation inhibitors was to install a fluorine at the C3 position of the sialic acid. And what this serves to do is to destabilize these intermediates such that once we have the formation of the covalent intermediate, the subsequent hydrolysis step is slowed down quite a lot, so that we now have hydrolysis times that could be measured in days rather than minutes. The problem, of course, is that we've destabilized both parts of the formation of the intermediate and the hydrolysis of the intermediate. So we need to do something in order to fix this first step of getting to that fluorosialicyl enzyme intermediate. Simple way to do that was to install a good leaving group, and in this case a second fluorine atom fits the bill. And so now what we have is a much easier way to get to that fluorosialicyl enzyme intermediate, because the reaction is driven by having a nice leaving group here. So what we've done is we've lowered the activation energy then for the formation of the intermediate, and it's now we still end up with the covalent intermediate with that fluorine, which still has the slow hydrolysis kinetics. So in essence, what we've been able to do then, is to put the enzyme to sleep. So the kinds of compounds that the Withers lab has gone on to synthesize was starting from the initial compound, which was simply the difluorosialic acid, was to go back knowing that substitutions at the 4 position, in particular the 4-amino and the 4-guanidinial substituents, add quite a bit of specificity to the binding and would help lower the KIs for these particular compounds. So a series of these compounds were made and tested, and to make quite a long story short, it turns out that the compounds that have the equatorial fluorine at the 3 position seem to function better than those that have the axial conformation. If we look at a table that was published in that science paper showing inhibition of the viral neuraminidase on the viral particles, in particular, let's just look at 2 that are outlined here with the yellow boxes. We can see that these 2 viruses show resistance to oseltamivir, which is the Tamiflu equivalent. And in one case, we see resistance to zanamivir, which is the initial Ryerson compound. If we then just focus for a minute on the equatorial fluorine with the guanidinial substitution, we can see that the IC50 value here of 8 nanomolar for these strains which are resistant to the current drugs makes this compound look pretty good. Similarly, if we look at a classically resistant strain, this H275Y mutation in H1N1, which confers pretty much complete resistance to Tamiflu, we've got pretty good inhibition still from that equatorially substituted, the equatorial fluorine with the 4-guanidinial substituent. So the other piece of information that came from this particular work was that there was a structure of the covalently bound inhibitor in the neuraminidase from the N9 subtype. And what was particularly nice to see is that the binding mode for the covalent inhibitor is as you would expect, with the involvement of those residues that we were talking about before, E227 and E119, and we've got rather nice density for the covalent linkage to the nucleophile tyrosine 406. So what I hope I've been able to show you is that in terms of basic drug design with this mechanism-based inhibition, that having a good enzyme structure with the ligand is an essential part of being able to tailor these compounds. Obviously, a good understanding of the mechanism and some prediction of what the transition state is going to look like is necessary to build compounds that are going to have the best possibility for inhibition. I think the take-home message that the difluorosialic acid compounds in this particular first study show very similar in vivo activity to zanamivir, and in fact in this particular paper there was an animal study which showed that at concentrations the equatorial fluorinated compound with the 4-guanidinial substituent works as well in inhibiting influenza in the mouse model as zanamivir. Now clearly more drug optimization needs to be done, and starting with knowing that the equatorial fluorine at C3 are better, this has been a jumping off point for some optimization, some of which is already published, but I don't have time to go into today.